Okay, so we're going to talk about posterior anterior posture, which is also known as sway back. So with a posterior anterior posture, this is someone who their rib cage is posterior to their pelvis and then tipped anteriorly like this. Okay, so going back to neutral, it's rib cage posterior and then tipped anterior. And this person tends to have more of a flexed posture in their mid back and then get some compression down into the lower back. So in order to correct this postural positioning, again, I will get into it, posterior, anterior, you first have to really take yourself out of this closed down or anterior positioning. And in order to do that, there's different ways that you can do it. I'm going to see if I can do it with just my hands on my chest. So I'm here, and then I'm going to take a big breath in. And that takes me to the posterior positioning. Okay? Now it's the same correction for posterior, but I've already taken the breath in. All right, so I'm here. Now I want to get over the arches of my feet, find my feet using my peripheral vision, and then as I relax my stomach, I need to relax my stomach down into my pelvis, away from my rib cage, and then as I breathe out, I then can relax the posterior tipping down into my relaxed abdomen. And then I am now in a more vertical position. So again, the big key with this one is if I'm posterior or anterior, I have to take a really big breath in to get myself out of that flexed position into that kind of posterior position before I can then come back over and get into a more vertical stacked position.